One of the hidden perks about watching 3+U, I think, is that you can get healthy when you watch this show. So if you are waking up this morning, getting into your day and feeling a little bit like you've got a pain in your shoulder, I'm doing that because I have one in my shoulder. We are all in luck this morning because Dr. Bradford Mitchell is paying us a visit. He is an orthopedist with Center for Sports Medicine, and the topic today just happens to be shoulder impingement. So great to talk to you.
Thanks for having me, Julie.
Okay, I'm guessing that what I'm facing, which seems to be more of a muscle tightness in my shoulder, that is not necessarily the same thing as hop and a skip over to a surgical fix, right?
Yeah, often not. And really, I'm a non-operative specialist with Center for Sports Medicine. And so we're talking about a topic today, subacromial impingement or impingement in the shoulder, that oftentimes we can improve without going under the knife. The worst kind of case scenario, there's some patients that do need surgery for this, but you're right. Oftentimes we can take care of this type of shoulder problem without needing surgery.
I'm glad you mentioned that right off the bat, because probably a lot of people are almost afraid to walk through those doors because they don't want to have to face a surgery. So first of all, what is an impingement in your shoulder?
Yeah, well, like the name implies, it's a pinching type process, and I've got pictures of kind of the bones of the shoulder to kind of help orient us here. So this is basically looking at somebody's right shoulder, just the bones. So you have your arm bone that comes up, called the humerus, forms the ball of the ball and socket, and then the roof of the shoulder here is called the acromion. And really there are two types of impingement I'll touch on, but by far the most common is an impingement underneath this bone called subacromial, underneath here, subacromial impingement. And that basically what lives in that space are the muscles and tendons that we've all heard of called the rotator cuff, which basically hold the ball in the ball and socket and help raise the arm and rotate the arm. And when we raise our arm up or out to the side, the ball of the ball and socket and that roof of the shoulder, the acromion, squeeze together and compress or pinch what's underneath the acromion. And that's why we call it subacromial impingement.
Okay. Now, when you talk about the rotator cuff, a lot of people will have rotator cuff surgery. So is that the result of not dealing with this early enough?
In some ways it can be. I mean, I think there's a spectrum of this rotator cuff disease process and a spectrum of this subacromial impingement process. So really early on in the impingement process, it's more of a compression, mechanical problem that really develops into an inflammation problem as well. And like what happens in arthritis, really inflammation, which has some beneficial properties, really once it goes unchecked and out of control, becomes a problem. And so early on with subacromial impingement, when there's not tearing in the tendons of the rotator cuff, it's not a surgical issue necessarily, but it can develop into that. There are different types of rotator cuff injuries. You can have a traumatic injury that happens suddenly and acutely and is less this kind of chronic, insidious thing that we think that I talk about when I talk about subacromial impingement. That's more of a gradual process that happens mainly in folks that do a lot of activities where they're reaching overhead or their arm out to the side, because that's what narrows and squeezes those bones together.
So if you're not fixing that surgically, what are you doing? How do you treat it?
Well, treatment largely focuses on kind of the two sides of this problem. It's both a mechanical problem of those two bones squeezing together, and really the way that we help that first is stop doing the things that pinch the two bones together. But really, it's a little more involved than that. So that acromion bone at the top of the shoulder, that's actually connected to your shoulder blade in the back. And as long as we've dealt with this subacromial impingement process, really relatively recently, the last 20 or 25 years, we've come to appreciate more and more how important the shoulder blade is in this disease process and especially in treating it. So a big part of what we do in treating subacromial impingement is therapy, physical therapy. I give folks the home exercise program when they're in my office, but a big part of that are really shoulder blade type exercises that we can start while the shoulder is still somewhat painful, where we wouldn't want to do rotator cuff strengthening rehab while the rotator cuff's very painful. There's still exercises we can start early that are aimed at rehabbing the shoulder blade so that it can help the position of that roof of the shoulder, the acromion, to open up the space for the rotator cuff below it.
When people come to see you at Center for Sports Medicine, as I'm sure they well know, you have got a slew of different orthopedists so that y'all can each specialize in your own area. If someone's watching you this morning, should they call and specify the need to make that appointment with you?
I'm happy to see anybody that has shoulder issues. Yes, we have in our group, we have sports medicine specialists that really focus on this type of injury. That's one of the benefits of Center for Sports Medicine Orthopedics is we're a big enough practice where we have subspecialists that focus on certain body parts and certain injury types.
And is the physical therapy done there in-house, or can people go to a location that's close to where they live, or does it matter?
Both. I mean, we do have great physical therapy options, and one thing that we're really excited about for our athletic population too is we have sport-specific therapy. But yes, I mean, we can work with patients if their place is closer to home. We work with a lot of therapy groups around town.
Dr. Bradford Mitchell, I tell you what, you got me on non-surgical. That's a huge thing. And I think maybe you just diagnosed me in a telehealth call. So thanks. I'll have to send you a copay.
No, that's all right. Anytime.
I'm sure you helped an awful lot of other people as well. So you can find Dr. Mitchell at Center for Sports Medicine. You heard him say what is very true, that they do have this arsenal of orthopedic surgeons and non-surgical specialists who can help you get over your particular health issue and back to living your life. That's the goal. Go to sportmed.com, that's their website, or give them a call, 624-2696. Thanks again.
Thanks, Julie.